Only 10, brother.
No. Welcome everyone to the cafe. As you see here, you have two remote guests today. You are joined again this week by Will Pierce and the lovely.
Clayton Clemens. Hey, everybody.
Yeah, great to be here with everyone. Listen, we've got a lot of really cool things to talk about, but we would be remiss if we did not talk about big geese. Am I right, Clayton?
Big geese. I'm pro big anything,
Yeah.
big water, big geese. There's a whole big water situation going on. You don't want to know about it. So,
All right. Fair enough. Well, listen, speaking of water, we just finished getting our hot water heater replaced. So
oh,
we've been without hot water since Friday at like 9 o'clock at night. And if you want to talk about feeling like a caveman, that is an egregious feeling to have
I-
no hot water.
okay, you've got two kids. How do you give cold water bath? How'd that go about?
We didn't. We didn't.
Yeah, just stinky
We actually
boys
went
for the weekend.
we went over to the in-laws and we tried to
Oh.
minimize outdoor time as well. Yeah. Because like here, I
Smart
learned
play.
something new today in my almost 31 years of existence on this earth is that I can't even run the bath if there's no hot water. Because like we turned the water off to it because ours was just leaking. So like the water wasn't running to our hot water heater at all for like
Yeah.
4 days. So if I tried to even turn it to just cold, it would just like trickle out. Yeah. So I just like I couldn't even run like even a cold bath for them
I
for a few days.
I just realized how little about plumbing I actually understand.
Yeah.
Because my brain says there's a cold one and a hot one, and they just blend together. That's not how it works.
No, not necessarily. But like plumbing is one of the things I won't DIY. I'll DIY a lot of things. I don't touch plumbing because if I screw it up, it causes so much more problems.
Smart play. Smart play.
Yeah. Yeah.
Okay, so this is an episode on plumbing.
And why not to DIY it? No,
Yeah.
actually, we do have a lot of really cool things to talk about today, but I think we'd be remiss if we didn't talk about what seems to be breaking the social media internet news for about the last week and a half to 2 weeks, and that's the Part D subsidy.
Yeah, so as a lot of you guys know, I'm not on social media much anymore. So
Yeah.
I pick up little news stories or like things in the office, and then I start doing my dives into it. So what I'm understanding is it's not necessarily anything to do for clients, correct? It's like not like an ACA subsidy where now everyone's paying a whole bunch more, or where am I wrong here?
Yeah, you're not too wrong. So no action needed for the clients on this. The downside to all of this is that like the social media headlines that are coming out from, I can speak at least like our local news company was like Part D is ending, just factually untrue. But the problem is that's what our seniors are seeing online.
Gertrude says, "Did you see what they said on the book face?"
Genuinely. And I know our agents are getting questions out the absolute wazoo on this. So, in short, and producer Alex will chime in if we get any chat questions, which please do type in the chat.
It's
Please do
true.
not text
We
Olivia
had one.
today.
Brad jumped in,
Ooh,
said, "If it's already hot water, does it need to be heated, or is it just a water heater?" So, got the water heater goes
mm.
coming in. I like that.
Here we go.
Listen,
I also
I'm
realized how
game
much I
for
don't know about plumbing. So, thank you for being a guinea pig for us all, William.
it. I'm happy to take that one for the team here. Please do not text Olivia this week. She is traveling, and so she will not have any clue what you are referencing if you do text her. So please do not text Olivia.
Hmm.
She will have no idea what you're talking about.
See, that's where we differ, Will. I say text her, say something off the wall, and blame Ben. I don't know.
Joke's on you guys. The number's not even up there right now. I tried to spare her since
Yeah,
she was going through a slightly stressful airlines situation.
she
Oh
she
Usually, I'm
yeah.
is.
always down for
So
bullying her.
for those of you that fly, you'll know that like American Airlines is generally a pain to deal with. We're having some flight delays for Olivia, so do send her good vibes. If you do, she's currently in a battle with American Airlines on some travel right now. But back to the Part D subsidy. I promise we'll try to stay on topic today as much as reasonably possible. Anyway, it's a me and Clayton episode. It's going to be a little bit more haywire. Here's what's going on with the Part D subsidy. So going back a couple of years, they initiated a $15 per member subsidy for Part D drug plans to try to help with some of the cost burden. It was a voluntary enrollment program at that time for the carriers. Most carriers opted in. Would kind of be silly to not opt into some government subsidies, right?
Yeah,
Um,
that was 2 years ago, right? When like big
yep.
disruption, like the first year of our big disruption.
Yes.
Okay.
Absolutely. Absolutely. Fast forward to coming into 2026, it renewed within Congress because it was always going to kind of be a year to year program, but it renewed with way less support amongst our congressional offices. Now, coming into this year, it is not renewing for 2027. So the administration is saying we're done, no more subsidy on this. A couple different ways that could play out. Rebids with the carriers were just due on August 6th. So rebids have all been turned into CMS on what they're anticipating. We should have a little bit more guidance here in a few days, a week, as more information starts to come out. I think it's a little bit short-sighted to say this is just going to go to premiums, though. Because there's a couple different ways that this could offset it. And I think carriers know premium sensitivity is really high right now with our clients, right? Like Part D plans are just extremely expensive in a lot of cases.
Mm-hmm.
So are your med subs. Those premiums just up, 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 up every single year. So I think premium sensitivity is really high. I think we're going to see a lot of formulary changes. Like there's
Ooh.
nothing to say that this subsidy falling off has to be applied to premium. It can be applied anywhere within the plan benefits, which for a Part D plan is either premium or formulary are the two big avenues that they can make changes. I expect a lot of formulary changes. Clayton, what should our agents do if we're anticipating a lot of formulary changes to be ahead of that?
So if you're not already collecting drug lists, that's telling me you're about 3 steps behind right now.
Yeah.
Because with those formulary changes, we know that means plan changes are coming down the pipeline as well.
Yep.
Like clients that have been on the same plan forever, it might not be that path anymore. I'm more worried about the big client drug lists. So like the
Mhm.
clients that have the big drug lists, the ones that you know are like your go-to problem children, they might need a phone call this year of just like, hey, let me get that information as early as possible if you haven't seen it come in from them. I know, like, we
Yep.
usually say, like, if you have a client that isn't adapting to your technology or
Mhm.
isn't getting you to drug list, they just kind of miss a PDP this year.
Yeah. Yeah.
That that works. That's gonna happen. I know there's a lot of big-hearted folks out there like myself that will say, "Give Gertrude a call. Say,
Yeah.
Gertrude, I need those meds. Things are looking odd this year. We need to get it taken care of early." If
Yep.
Gertrude doesn't, at that point, I feel a lot better about myself. I can take that and be like, all right, I can sleep at night. I did my best effort to try to do this for her, knowing that we're
Absolutely.
not going to have any other enrollment periods to gonna go through for Gertrude's
Mhm.
of the world. But at the same time, we can't be chasing the PDP commissions of
Yeah.
what very low if one carrier pays. And do you think, on that note, like, do we see more plans go the non-commissionable route? Like, I don't know. I only knew of one, Cigna, that paid.
Mhm.
Were there any others out there that like we're just not really like working with that pay?
I think of the national carriers, I don't anticipate any changes on that front. I don't
Yeah,
think anyone that was non-comp is going to magically come back around now.
yeah,
I don't
seemed like an odd
forecast
move
that
at this
happening.
time.
Yeah, right. So I think Clayton, you hit the nail on the head though. Like we've got to get drug lists in this year. If you're still servicing your PDP clients, if you're choosing to make that business decision for the agency, for your client's best interest at heart, we have to get drug lists this year. I don't think there's any way around it.
Yeah, like to chase that during what could be a 15-minute, 10-minute appointment, to
Mhm.
chase that and look around for it and stretch that thing to an hour as we're following her around the house trying to grab any
Yeah,
other and see what we need to add.
yeah,
It, it, it can't do it. Like
no,
that's not feasible for the agency. But an extra phone call to try to retrieve that information from your problem children or
Yeah.
your influencer clients. I know something Olivia talks about all the time, like giving them a call and just saying like, "Hey, like I love to try to keep you guys on the best plan. However, I don't know what that's going to be. I got to get these
Yep.
meds early so I can get that information to you as soon as possible."
Yep. And it's gonna be another year of large numbers of our clients getting negative ANOX again
Yeah.
this year. So if we kind of, if I put those two forces together and I say big formulary changes plus negative ANOX equal lots of phone calls from clients, I think heading things off early is always a good move.
So on the PDP subsidy
Mhm.
or the Part D subsidy, is that just for PDP? My brain was like already getting ahead of myself. Is it just on the PDP or is it also affecting the MAPD side?
It'll be the biggest effect on the standalone drugs because they don't have as many levers that you can pull like an MA plan does.
That's what I was thinking. Cause like if an MA plan can be like, yeah, we'll get rid of your dental, we'll cut
Yeah,
this other little thing over here, where PDP is like, wow, like you said, it's we already cut paying agents.
right.
We can't raise the premium to a point where nobody wants to pay for it.
Yeah, absolutely.
Is but there's like rules around what they have to cover. So like they have to cover something of each type of medicine. How does that work exactly?
Yeah, each category of medication has requirements of the number of them. So we may see, a bigger push to just going down to those bare minimum requirement thresholds that they have to meet rather than having multiples in a category. We could see things shift tiers. What has maybe always been a tier two may jump up to a three or a four. Like a lot of weird nuances like that could happen that are really going to impact how our consumers shop.
Yeah. Okay. Well, like that makes sense, but like I guess it doesn't feel as scary. I just immediately assumed profit or like not profit, premium would go
Yeah.
through the roof.
Yeah.
I always look back at my dad's plan. That's like my
Mhm.
go-to like reference point in my brain of like, okay, he's on a med sup, like a high deductible med sup and a PDP.
Yep.
He the story I tell every year is one that you helped us with the enrollment of. If we didn't move him, he would go from like, oh well, my plan went from like 15 to 30 bucks. It's like, no, 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 sweet baby daddy.
Yeah.
It doesn't go that. It actually raises it by like a few grand because your
Yeah.
coverage isn't the same.
Yep.
And we end up
Yeah.
saving thousands throughout the year just by making him pay more in premium.
Right.
Like, no, Dad, this will
Yep.
work out. Trust me. Weird
Yeah.
math.
Absolutely. I think that segues into a really something that I've been thinking about a lot. It's just how differently our consumers shop now than like even 5 years ago. Like
Yeah.
I've been here since 2018, so I've seen a few sales cycles as we've gone through stuff. But like consumer shopping behavior is just so wildly different now, and I think it's been a huge impact to the way agents need to shop as well.
Yeah, like, do you mean like tech wise or just like what they're looking for? Because like I said, my dad would just be like, premium went up a little bit, whatever. But he's not the
Yeah,
like in tune
the
65-year-old
engaged
paying
consumer.
attention to all this stuff.
Right. Right. We do have a question in the chat. Are we expecting a major change with the well care value script?
Oh,
I would.
that's the $0 boy, isn't it?
I think, something to with the well care plan specifically is like if I think about the Part D market on the whole, well care has about a third of that membership by themselves.
Oof,
That's a lot.
oof.
If I kind of like take that to the next level with that, they are also a carrier that does not have a large MA membership to help offset any cost burdens.
Yeah,
If I think about our other like national players, United, Humana, Aetna, whomever, they have a lot of MA enrollment.
right. Gotta balance
WellCare
that.
really doesn't in a lot of markets. So that's an offset cost burden for a carrier like that.
Yeah, and what always seemed to be like a path. Hello, kitty.
Yeah, this is Wilma. For those of you that don't know, I work from home, obviously. Wilma is almost always on my lap when I'm in a meeting, so she likes to make an
Did
appearance.
this guy Will just say his cat's name is Wilma? That's
Yeah,
unacceptable.
it is Wilma. One-eyed. She has one eye. It's one-eyed Wilma. Thank you very much,
Okay, that makes
Alex.
it way more acceptable. You're good. You're good now.
So, before Wilma made it, just ooh, a cat. Yeah, so just kind of thinking back of like WellCare, not like it always seemed like that $0 PDP was a path to hopefully grow their MA
Yeah,
market, like right? Like it seemed like a almost a not a farming technique, but like,
sure.
hey, there's ways to get clients out of this, or now people are more familiar with our name, maybe they'll be more comfortable with us here.
Hmm.
Um, where if we're not seeing them have that balance, do we just expect it to it can't just go poof, right?
Yeah, I
I
don't know that it'll go poof.
think
I
I'm
just
speaking for all the anxious agents out there, like,
yeah.
"Don't make me do this."
Yeah, I don't expect it to go poof by any means, but it's going to be a bigger deal to Wellcare than it will be to some of the other carriers. Like the
Yeah.
way that they play it is going to have to be really important for long-term strategy for them. So I do expect changes. Again, will that take place in premium or formulary? Undetermined, but it will have a big impact to that. We're getting a lot of really good questions today in the chat. By the way, this is awesome. Michelle's asking about stricter SSBCI guidelines, and I think what's going to be really interesting to follow with the SSBCI. So rewind the clock a little bit. We used to be on what was called VBID, which was value-based insurance design. We are now on supplemental benefits for the chronically ill. So our DSNP members especially have been impacted by this of you
Yeah.
have to meet chronically ill guidelines to now get full benefits for your dual plans and for chronic plans. It's not new for chronic plans, but what we're seeing a really shift I think is going to help a lot of agents going forward, frankly, and that's that the qualification guidelines for those benefits now have to be public and published and easy to
Oh,
find.
is that new
Yeah,
this year?
it's new for plan year 27, so this upcoming AEP, which
Nice.
like Clayton, you can attest. How many calls do we get from agents of like, okay, they have this condition, but like, how do we actually qualify them for it?
Uh, Millions. I don't
Yeah.
even know, man. That was a crazy thing of like, I don't know. Do whatever you can to prove it, I guess.
Yep.
Like, if you can you take the doctor with them and just
Hmm.
go knock on the door
Yeah.
of the carrier? I don't know.
Some carriers said, oh, we'll call the member. Don't worry about it. Some said, well, they can call us and voluntary attest that they have this condition. It was just all over
All
the
over.
map.
Yeah.
It was so confusing for consumers and for agents. For this year, that's going to be published and publicly available. We're also going to have there's a couple things that are going to be really interesting to follow. Real-time purchase verification for some of these like OTC benefits. Yep. Clayton, your face is the same as mine when I saw that come through in the final rule. But
Sounds
all
great,
this, yeah,
but
yeah. It sounds really cool. Is hey, we're going to real time make sure that this actually is a qualifying benefit. That's awesome. In
how?
theory,
Yeah.
lots of questions around that. So make sure you're plugged in. If your carriers that do offer any SNP plans are doing local market rollouts in your area, please attend them. This is going to be a really big year to make sure that you're as up to date as possible of those changes.
Yeah, so many carriers are making a big push into that SNP market, the C SNP specifically, like trying
Hmm.
to make that like almost like feels like a little bit of like their profit balancing, right? Like they know what they're
Sure.
getting into more with the chronic client, and they can build a plan specifically for them. Where
Yep.
an MA client, they're like, you could be healthy, you could be the most sickly person ever. I have no idea.
Yeah. Yeah, it's, I think part of the overall theme with CMS of like we're trying to drive better outcomes with our consumers. The more plugged in you can be with your consumer base, the better you can drive a health outcome for them. And SNP plans are a really good way to get really plugged in with your consumer base. And it's pretty clear from the carriers that we're seeing a ton of investment in that market. And I would say a great opportunity for any agent that's not serving in that space to get involved with it.
For sure. And in some areas, the like the MAPD plans are just like they've tanked benefits or they've pulled and there's only a few options, but you'll see like a few CSNP plans. So
Mhm.
definitely in areas with like less availability of those plans, like
Yeah.
really important to get familiar with the C-SNPs available in your market.
Yeah, absolutely. But back to the consumer shopping behavior
Yeah,
topics, I really think, Clayton, you talked about a little bit with your dad. I think we have a really split consumer base of those that are just very disengaged,
yeah,
almost of just like, whatever, premium go up, okay. And then those that are very engaged with their
yeah.
shopping behavior. And that like sub 70 age range seems to be a much more of our engaged and less loyal consumers as well.
Yeah, they'll do whatever to be on the best plan. They're like,
Yeah.
who cares? Aetna, UHC, Humana, what who's gonna take care of me?
Right.
A lot of
Yep.
it boils down to that, where like, yeah, like my dad, he's getting close to 80 now. So like
Hmm.
we're talking he doesn't understand, like he doesn't know what he doesn't know. And I
Yeah.
think that's where like is someone like you like jumped in yet last or 2 years ago, I think at this point, and really
Hmm.
helped us out. But like he can hear it from me, but I'm just his son, he's gonna be like, "Oh yeah,
Right.
okay. I don't want to bother you with it. I know you're
Yeah.
busy." And I'm like, "Yeah, but like I'm busy taking care of people like you. Like
Yeah.
I want to help our agents help people like you. You're
Yep.
you're my top priority." And then it
Right.
trickles down from there. Like, I know this information and I deliver it to my parents. So like I'm
Yep.
like, "Hey, like I might not explain this the best. Let me get you to Will. We'll get everything taken care of." Or, hey, like, we just need to run this. I know what we're doing this year. We're all good. Like,
Yep.
it's just been an easy process. But for the seniors that don't, like, the disengaged that don't have either a very good agent that's
Hmm.
informing them of what they don't know, or a child, like, looking out for them and trying to help them enroll in
Yeah.
something, what what are we trying to push out to those disengaged folks? Like, how can we engage them that this is a very important thing for them to check out every year?
I think what's hard with that conversation is there are going to be some consumers that are just not going to want to engage
Yeah, they
for
won't
better
care.
or worse. Like they just it just is what it is to them. They've been on it for so long that like it is what it is at one point or another. I think things that are always important is making sure that if they do have a concern that they feel, found and felt on it of like, hey man, this is getting really expensive. Yeah, you're right. And a little bit of like a hey, here's why this is happening. I don't think we need to, 202 level discuss the intricacies of the Medicare market with all of our consumers. There are some that really love that stuff. And then others are just like, oh, okay, yep, that makes sense. What do I need to do about it? And like that's where most of our consumers, I think, are best served is okay, I understand why this is happening now. What do I need to do about it? What can we do with my coverage for this year?
Do you
But
think
I
that's
think something,
mostly like like I'm not easiest is probably the wrong word, but like best ways for agents to get that messaging out there? In my first thought, my brain goes to events,
yeah,
educational events before
yep,
AEP always being something to knock out a big conversation like that to
absolutely.
multiple people instead of what could be a 20-minute conversation about here's why things are happening and what you need to do
Yep,
about it. You start multiplying that out by how many clients you have. It's we don't
hmm,
have time for it. So
right.
like you want to be able to do it, educational event, which I know now we can turn into a sales event afterwards. So like there is opportunity there still. It's not just for the good of your heart.
Absolutely. I think group events, if you're not doing them, please call our office and ask how you can do them and what that can look like for you. Group events are going to be huge. Another really interesting trend that I've been hearing from some of my agents, Clayton, I don't know if you have, is that clients are calling them saying, hey, I talked to ChatGPT or I talked to insert AI platform here. These are the questions that I was told to ask, or this is what I know about it so far. And almost having to like correct AI on what it is telling our consumers, that's going to be a trend that I'm really interested to follow for the next couple of years.
Oh man, I didn't even think about that. I'm one that's like I talk to my AI bot all the time. Like I'll be doing my chores in the house and throwing an AirPod and just like be
Yeah.
brainstorming things I need to work on, or like,
Yep.
hey, I'm shopping for a truck. Let me talk to somebody about it because me, I'm chatty. And so like having that like where I know not everything is going to be super accurate and you have to kind of
Yep.
check it every once in a
Yep.
while. Again, so I'm picking on the Gertrudes of the world, but Gertrude doesn't know that AI doesn't know everything. Or
Very
you
true.
might have phrased something where it's like, no, I'm right because you phrased
Yep.
it wrong.
Right. Yep.
So that's
Yeah.
definitely interesting.
Yeah. I think overall, for agents, this really comes down in my mind to being an educated advisor for them. I hear from agents that have been in the business for forever frequently like, it's so different now than when I started. Absolutely. Not
Yeah.
only is the market different, but our clients are so much more different than they used to be when they retired. Like the entire way we have to approach the ecosystem is evolving a lot.
It's insanely different. Like you said, you've been to 2018, I was 2019, and like this has been, it almost felt like negatively impacted by the agent. Like, let's restrict the agent, restrict the agent, restrict the agent. And that got a lot of bad eggs out. But now we're
Sure.
dealing with like where all these bad eggs gave the information to. And like
Yeah.
now everyone's questioning, is this accurate? Can we figure this out? Like I feel like we're in a lot more of a space where people want to know, or at least like you're saying, like, just tell me like why and what I need to do at least.
Yeah.
Like I don't need to know the ins and outs and all these things, but as we're getting further like away from the boomers turning 65 and getting into more people that have been in the workforce recently and had
Yep.
dealing with the technology side of things and doing their own
Yeah.
research, it's everybody wants that.
Yep.
They want to be able to kind of feel they understand it to a small degree to then
Mhm.
tackle the problem, but they're not going to know how to tackle the problem by themselves. They might
No,
just know the background of there's a problem.
absolutely. I think all this to say it's still a great time to be in this industry. Like, I don't want any agent to see what's happening or hear what's happening and think it's not still a great time. Like, I would be, to quote some of our youth here at the office, all gas, no brakes, you coming into this AEP. Like, these are the best years to grow your book. Like, yes, they're
Yeah,
stressful. Absolutely no doubt about that. Like, when we get this many service area reductions like we're going to have again this year, they're stressful years, but they're also great years to grow your book. They're great years to serve our consumers where they need to be met and to get a ton of referrals. Like
yeah.
if you serve someone that's in a very impacted moment in their life, it's an amazing opportunity to say, hey, do you know anybody else that I could help with this year?
Yeah, anybody going through something that you might be going through as well,
Yep,
like, hey, just holler at me if you got anybody that reaches out or you guys are talking, let me help them. I want to be that person for you. Being that
absolutely.
strong member of the community, I think is something that's super important as always.
Hmm.
And like Will said, like this is an amazing time. They say pressure builds diamonds, right? Like this is the hard, stressful years that will build a long agency success.
Yeah,
Like, let's build on these things versus dreading all of the impact, all the
yeah,
negative. Uh,
yep.
I'm usually a positive spin kind of guy, so this is easy for me to do. But I'm saying like you got to look at where opportunity comes from, and it's going to be from turmoil. Like it's
Yep.
going to be bad things happening. Okay, how can I make the most of this?
Absolutely. And we didn't talk about it as much as I kind of wanted to come into this, but please cross sell people.
Please.
Like I think it in really short summary, and Clayton can speak to this as well. Like as we see plan benefit change, especially on the AMA front, it creates a massive need to be talking about hospital indemnity, cancer, home health care, whatever you want to focus on. Like as MA plans degrade every year that like we're seeing, I- that is just such a layup to talk about these necessary extra products.
I mean, a few years ago, yeah, I'd have to argue like, yeah, the plan's pretty good. They don't go to the hospital that often. Like, they'll probably be okay, but this is extra money. Now it's
Hmm.
like, no, no, no. Everything costs more. We've
Yep.
talked about this left and right of the price of eggs and a gallon of milk and a gallon
Yeah.
of gas. Everything costs more. That if we're not looking at their entire budget and people aren't budgeting out health care as part of that, like we know, like for example, like cancer is one of the leading causes of medical bankruptcy. It's like,
Yep.
okay, so we need to then look at how are we taking care of these people to
Yeah.
avoid people going bankrupt,
Yep.
to avoid people dipping into their savings they've worked so hard for.
Yeah.
Do they want a carrier to pay for that, or do they want to pull it out of their savings and, go from there?
Absolutely. I think something that I've been talking to a lot of agents about is rather than asking, can you afford that? Like if we're looking at an MA plan and the inpatient's $500 a day, hey, can you afford it? They might tell you yes, even if it would be terribly stressful for them. But rather ask, what is your plan to pay for that? Just like, hey, if you get diagnosed with cancer, where do you want to go to get your treatment? Like,
Yeah,
I want to make sure that if you do need that care, that we talk about what that looks like in advance. Of, well, I'd really love to go to Mayo. I know they're the best. Okay, well, did you know Mayo doesn't really like to work with Medicare Advantage plans? Like, you're going to have a lot of out-of-pocket costs, not to mention travel costs to do that.
yeah,
Like, there's really low pressure and educational ways to bring these products up. If you're not feeling really comfortable with that at the moment, please do call our office. Would Clayton and I would love nothing more than a conversation with agents of how to start doing more of this year.
for sure. One of my favorite things is from my boy Colby, who probably stole it from somebody else, but is you don't have to have a plan for everything, but you have to have a plan for everything,
Yeah.
right? Like we don't need to pick up coverage for every single, misstep a plan might have. But if
Yep.
you don't have a plan in place to take care of it,
Yeah.
what are we doing?
Right.
I'm not helping you with your health care then, because we're just saying, well, get that one out of here. But anyway, avoidance doesn't work when you have health issues. Like
Right.
you have to do something. Now what? So
Yep.
educate,
Absolutely.
get things in order, make sure folks have a plan.
Yep.
Make sure you have a plan before when these plans, the degradation comes down of like, what am I quoting? What am I looking at? Like,
Hmm.
what do I feel comfortable with selling to my clients? We can
Yep.
help make those decisions, help point you in the right direction. So let us be a sounding board. I love that. I love being able to be that kind of business coach, that kind of
Hmm.
person that immediately gets on your side of the table and I'm trying to tackle a problem with you. Like that's
Yeah.
one of my favorite things to do here.
Absolutely. Clayton, any other parting thoughts you want to leave our agents with today?
I do. We didn't talk
Okay.
enough about big geese.
Yeah, that's fair. That's fair. I
That's
thought you
another.
were gonna
Let's go ahead
say,
and bring it back to
sign
the
up for
geese if
the.
we could. If we can bring it on back to the geese.
I thought you were gonna, jump into the boot camp there, but geese work. We can talk about
You
geese.
might see
Okay, yeah,
geese at the
sure.
boot camp. It's not off the table.
There might be a goose at the boot camp. You won't know unless you RSVP. August 19th, Columbia, Missouri. Be there.
Yep.
Ben's gonna be wearing a cowboy hat and just wrangling a goose the whole time.
I would love nothing more than that exact sequence of events to occur.
Well, I think I just appreciate Will always sharing a bunch of knowledge. Thank you all for some great questions today. I don't have anything else to add other than I do want to take a picture that I'm going to take post for Olivia of how silly my background looks behind the scenes.
Uh,
So let
Karen
me
says
just
she
grab
wants to read
that.
my coffee cup. It says, if you believe any of this at all, it's from a podcast that I listen to called Astonishing Legends. So if you're into like folklore and like cryptids and like weird stories like that, it's a great podcast to listen to. But it says, if you believe any of this at all.
I'm more of the
Yeah,
Silly Boy podcast, I guess, if
that's fair.
anyone couldn't have guessed.
Yeah. Color me shocked. Color
I
me
mean, that could
shocked.
get a little
Well,
silly, cryptids and mystic. I mean, if you believe any of this at all, I'm sure it can get a little silly.
there we go. So there we go. Awesome. Well, thank you guys so much for joining us today. And Clayton, until next time, have fun,
Make money and give
And
impeccable
give
give
service.
impeccable
impeccable
service.
service.
Oh,
We
there
are
were too
so
many
Wow.
people.
off
Too
time.
many people involved. That was so bad. That was so bad.
Thanks,
Too many
everyone.
people.
Great team.